So much excites me about what I do. Every time I see patients, it invigorates me, and I'm just enthralled with both their disease and how I can make an impact on that disease. And at the same time, it really feeds into the research that I do, and excites me to go back to the lab and to try and make a real impact on their lives. At the same time, my research is really at an exciting stage right now. We're moving towards therapeutic development. And I think that knowing that I actually have patients that I see with these conditions is a driving force to move that research forward. I think that patients play a major role in determining their own care. I actually have discussions with patients about what the best possible therapeutic options are, or I provide them with a list of options, and we go through and make a choice together. I also think that patient outcomes are often dictated as much by the patient's outlook as it is by anything the physician can do. And so I make a lot of efforts to encourage the patients to take as positive an outlook on their situation as they can. I also encourage most of my patients, if possible, to get involved in some clinical trials, because patients always do better in clinical trials, even when they're receiving the so-called placebo or sugar pill. And that's a lot of times, I think, because those patients are making an effort to improve their condition. And so I think that positive outlook is something I try to convey to all my patients.